I'm Rachael Dorsey. I'm an occupational therapist with UF Health Rehab in Gainesville at the Fixell Institute for Neurologic Diseases with Dr. McFarland, which we happen to also be a CurePSP Center of Care. So we'll be talking about enhancing accessibility and independence in the home. So the first aspect of this was touched on quite a bit today, is the importance of a multidisciplinary care. These are complex diseases that we're talking about, and once again, there's not one single provider who's going to be able to give you all the answers. So starting with a movement disorder neurologist is very important. It is worth traveling for. Even if it's a yearly evaluation, it is worth it because they are also going to have either the resources in their clinic or the ability to refer out to these other specialists. So I'll go over a little bit more of kind of the rehab roles in this multidisciplinary care. I do want to speak a little bit to the question earlier about having to wait to see a movement disorder specialist. Very often you do not need to wait to see a rehab specialist. So this could be some way to help kind of bridge the gap. And I'll talk a little bit about how to get in there, but starting therapy right away can be helpful in optimizing care all the way around. So us occupational therapists, we work on the things that occupy your time. So everything from dressing, grooming, bathing, toileting, to managing your home, yard, work and leisure activities. We can do equipment recommendations, bracing recommendations. We go over energy conservation, ergonomic recommendations, and exercise prescription. Physical therapists, they're mostly going to be working on mobility training, balance exercises. This can also be caregiver training on how to help with mobility for your caregiver, for your person with atypical Parkinson's, exercise prescription as well, bracing and assistive device recommendations. So it is very important to get the proper mobility device recommended. And very often, even if it comes to a cane, it's not very typical to be able to use it properly right away. So it's important to get the proper training of how to use the right device and at what times. And there might be a couple different devices that you're using. So working with a therapist. The other considerations here is insurance. Typically insurance is only going to cover the cost of a mobility device, one device every 5 years. So you want to make sure that the device that's covered by insurance is one that's going to be the most beneficial for you for longest. Wheelchair evaluations are also recommended so that it's a proper fit, and once again will be something that lasts you for the long period of time. Mostly physical therapists, but also occupational therapists do this. Speech language pathologists, once again, they're going to do swallow evaluations as well as treatment. They can work on respiratory training that helps with swallow safety, intervention for speech and communication, and cognitive treatment and evaluation. So where you'll find this rehab team, you can find it in multiple settings, including inpatient acute hospitals or going to a rehab facility, rehab hospital, or skilled nursing, home health agencies, and outpatient clinics. Now, very often, independent outpatient clinics are very orthopedic based, so where you go to get knee, hip, or shoulder work done, whereas what we want are people who work with patients with neurologic conditions. So very often looking for your CurePSP centers of care, because we know not only do they know neurologic conditions, but they're going to know these atypical Parkinsonisms. But if you don't have one in your area, then looking at hospital-based systems, they will at least have a basic understanding of neurologic conditions and be able to treat you kind of from the symptoms in. There was a caregiver today who spoke about meeting with curious providers, and I do think that if you don't have someone specifically trained or a CurePSP center of care, then finding a curious provider is very helpful. That someone's willing to do the research and work with you on your disease process. And this CurePSP handout or pamphlet for everything what every social worker, physical therapist, occupational therapist, speech language pathologist should know about PSP, CBD, and MSA. This is a great handout. So any of the, and this is part of what got me started at a movement disorders clinic for understanding these diseases. So once again, that curiosity is beneficial. There are also other specialties like hand therapy, pelvic floor therapy, and these are all outpatient-based clinics. So your neurologist can refer you, your primary care provider can also refer you, and so that can be a good place to start. So when it comes to independence in the home and just in general, we'll go over some general concepts. The first one is energy conservation. And this is a little bit the idea that with these diseases, you kind of start the day with a certain amount of energy, right? You say, here, this is the energy you're allowed that you're gonna have for the day, don't use it all in one place. So some of the ways that that might happen is really making sure that you're pacing your activities appropriately, planning ahead for how you're going to do them, or making sure that you're not doing a lot of back and forth, prioritizing, so this might mean delegating tasks, and then positions, what are the best positions to be doing that in? If you're one of those people who just goes, and has a hard time monitoring that, then sometimes thinking about 10 minutes of rest for every hour of activity can be a good way to make sure that you're getting a little bit of that proactive rest to avoid over fatigue that makes falls worse and cognitive function worse. The other thing that's super important is exercise. So aerobic exercise is a little bit of that magic pill we're all looking for. Aerobic exercise is important for managing the fatigue. We know that having these diseases means that every day, everything is harder. And so you actually need more endurance than the person sitting next to you just to get dressed every day. So in order to do that, you need to have aerobic exercise to give you more endurance. And so that can be a good way to address some of the fatigue. It also helps with sleep. It also helps with memory and thinking. It can help with mood. So it really is something that is super vital for maintaining function. So sometimes balance and blood pressure considerations can make it like, well, what exercise can I do safely? And in that case, we look at things like aquatic exercise or maybe a stationary recumbent bike or like those ergometers, the little cyclers, to be able to get exercise safely. I recommend working with a therapist or a personal trainer who's familiar with neurologic conditions to work on a specific strengthening program. The Silver Sneakers programs or the seated exercise programs available at your local senior center are good options. And then flexibility exercises, so stretching and yoga exercises can be good to help manage a lot of that stiffness and rigidity, which impacts your posture and your mobility. So now we're going to break down into kind of daily activities. So starting with eating, the first thing we look at to make eating more independent is doing it safely. I know we've talked about some of these in the past, but one thing that's super vital is making sure that you are brushing your teeth or your mouth, if you have no teeth, 2 to 3 times a day, because that bacteria in your mouth actually increases your risk for pneumonia if you are aspirating or swallowing the wrong way. Make sure you avoid distractions during your meals, which I'm glad most people are done eating now. Avoiding watching TV or listening to the radio. Taking small sips and bites, sit in a supportive chair at a table to allow for better posturing, and then work with your respiratory therapist on swallow safety or respiratory training that can help with those things. In regard to independence, you can look at using something like a scoop plate or a pasta bowl to avoid spilling food, using large handled or angled utensils to help bring the food to the mouth, use cups with lids to avoid spills. If there's lacking neck range of motion, there's something called a nosy cup that allows you to be able to bring it up all the way to drink to the bottom without the need for extending your neck. And then hydrating, you'll hear as a common theme, is very important. For grooming activities, sometimes it can be as simple as sitting down to do them. So if it's endurance or balance or pain that's limiting you from standing to do it all, then sit down. Maybe find a different location with a basin and water to be able to do the same tasks. Using electric toothbrush or electric razor can make things easier for you. And then using adaptive equipment like magnetic jewelry clasps and adapted nail clippers or stabilizing eyedroppers can be helpful. For getting dressed, this is where a little bit of that flexibility comes in. We say stretch before you dress. So that stiffness can kind of limit your range of motion and posture, what makes it harder to get dressed in the morning. So very often we recommend some of your flexibility exercises to be before you even get out of bed. So it can be 5 to 10 minutes. It doesn't have to be a lot. A little bit goes a long way, and it can help with that general mobility first thing in the morning when you're most stiff and help you get going a little bit. Sit down to put your pants on. You do not need to be standing to put your pants on. You're not giving anything up. You're only putting yourself at risk. So sit to do that. For fasteners, there's clothing with magnetic fasteners, or you can work with a button hook. There are lots of videos on YouTube for that. For bras, putting front fastening bras or overhead, using a step stool or crossing your legs to access your feet. And then there are these metal frame compression sock donners that can make it easier to get those on. And then you can wear slip-on or no-hand shoes, like the Kizik brand, for example. For bathing, there are lots of long-handled options for brushes, razor handles. There are suction cup foot scrubbers, definitely using a non-slip mat in the shower to prevent falls. Using soap and shampoo dispensers, and sometimes using a shower mitt, just kind of minimizing the difficulty or the number of things you're using. When it comes to balance safety in the shower, we often look at options in regard to shower chairs. So there's a wide spectrum of them. The 3-in-1 commode is the one in the top middle there. And it's called 3-in-1 because it can be used in the shower, over the toilet, and or next to the bed. This is the only device that might be covered by insurance, once again, unless you have VA options or if you have a long-term care plan. But otherwise, this one could be covered, but generally you have to have documentation of limited mobility for it to be covered. But this is an option. And so that can be put into the shower. Basic shower chairs with armrest or without tend to be a little bit more affordable options. Then for tubs, so tubs are not always necessarily unsafe as long as you have the right device. So there are tub transfer benches that you sit down on the outside and then scoot into the shower. And then also there are sliding tub transfer benches. Those are a little more expensive, but sometimes they have a whole system that you sit on it even over the toilet. You can use the bathroom, then scoot the seat itself all the way into the tub. And it can be helpful for caregivers. The thing that tends to be the most long-lasting is in that top right corner, rolling shower chair commode combination. So these tend to be pretty pricey, and you do have to have no threshold, but this can be the most accommodating for the longest period. So for going to the bathroom, most obvious are grab bars, making sure they're installed in the studs in your wall. There are different options for being able to push up, have something to push up from safely, like the raised toilet seat or putting the 3-in-1 commode over the toilet or the toilet safety frame. There are electric sit-to-stand toilet seats. Those are also a little bit pricier. Bidet attachments. I recommend this for everyone, even if you don't have trouble wiping your bottom. So it is the better way to clean. It's a really good way to prevent infection. It's a good way to help with skin integrity. And there are multiple options on the market ever since COVID and toilet paper was a shortage. So Lowe's, Home Depot, Amazon, Walmart, you can go online and find them very easily with all the options, and they are great as anyone who uses them. And then using a toilet stool, so especially if you're using an elevated toilet, then your body's really not in the best position to eliminate your bowels. So making sure you have something to raise your feet up so you're a little bit more in that squatted position. Hydration is vital, and hydration actually does help with bladder issues, even if you're going to the bathroom frequently. What happens is the less we drink, the more concentrated our urine becomes, and the more irritating it is to our bladder. So you actually want to drink more water to dilute your urine so that your bladder can hold it for longer. And it helps with bowel function, so hydration, once again, is important. Now, I know a lot of these conditions have bowel and bladder issues that are related to the disease, but there are also some conservative measures that can help improve or lessen the symptoms, and you can see a pelvic health therapist for that, and most hospital-based systems have that, and you can get referred from your doctor. I'm going to skip ahead to this next one. Sleep, we know, is important, right? If we're tired, then with atypical Parkinson's, your falls and your thinking is going to be worse. So we look at just the most basic things. Make sure that you have a good routine for sleep. So make sure that you have a comfortable, dark, cool room to sleep in. Make sure, research really says about 2 hours before bed you want to avoid screens. I say that's probably unreasonable. If you can at least get 30 minutes of time, that's no screens. I think that's a little more functional in our day. So doing something calming and relaxing. I always say you want to think about your brain as a baby, right? You can't just stick a baby in a crib and say, good night, see you later. So you have to kind of treat it that way by telling it through your routine and habits that it's time to shut down and go to sleep. Avoiding caffeine, alcohol, and heavy meals before bed, going to bed at the same time and waking up at the same time, and then daytime exercise is really important. When it comes to getting in and out of bed, sometimes this can also be disturbing to sleep, so making sure that it's easy and safe to be able to do that. So there are some equipment like bed rails can be attached to beds, and those can be used either for transfers or sometimes even to if you're having a lot of acting out of dreams, sometimes fall out of bed, sometimes just having a little bit of a barrier wakes you up enough that you can adjust yourself. Slippery sheets, there are different brands on the market that can help with turning in bed. Just be careful getting up. Using a wedge or pillows for positioning, and then motion detection night lights can help with fall safety at night. Make sure you keep your assistive device next to the bed, okay? So when you get up to go to the bathroom, you use your walker or your cane. Make sure it's available and easy within reach. You almost have to walk over it to get to it. Consider the height of the bed should be a good height that's easy to get up, but not too easy to slip out of. And then, the person with atypical Parkinson's probably going to want to have the spot that's closer to the bathroom. And once again, keep your walkways clear. So one of the other things that can be very disturbing to sleep is the frequent urination at night. So very conservative measures are elevating your legs for about 20 to 30 minutes, about 2 hours before bed. This allows any fluid that might be in your legs from swelling to be processed by your kidneys before you go to sleep instead of the first time you lay down. And then you're going to decrease your fluids about 2 hours before bed. This is only if you're hydrating well the rest of the day, though, okay? So drink lots of water during the day, decrease your fluids about 2 hours before bed. Using a urinal or a bedside commode can sometimes be a little safer or decrease how alert and awake you have to be to go to the bathroom and come back. And then there are different external catheters that are available for men and women now, and then using bed pads that might make changes a little bit quicker and less disturbing at night. So when it comes to mobility and assistive devices, I'll reinforce again, I definitely recommend this being prescribed by a therapist that's working with you and can train you on the proper device. And once again, you might have a different device for a different environment or the different types of tasks. So some devices you might see are a cane, a 4-point cane, walking or hiking sticks, a regular fold-up rolling walker, a rollator. Upright walker is one you can have your forearms on, and then the U-step walker is kind of the golden walker of Parkinson's and atypical Parkinson's because it's a little heavier, it counters the falls, and the functional use of the brakes tend to be a little bit easier so it doesn't get away from you. Transport chairs are a great thing for caregivers because they're lighter weight than wheelchairs, they're a little more affordable, and they can sometimes allow more access to the community. Manual and power wheelchairs, once again, I recommend a wheelchair evaluation for this. Gait belts can be helpful to allow people to walk for a little bit longer as long as caregivers are able to safely assist them. And then there are different types of lifts. The Hoyer lift is usually one that is covered by insurance. There are also sit-to-stand lifts for when mobility tends to be more of an issue or if there's a huge fluctuation in mobility. There are other things that can help with some safety, so thinking about environmental control systems like Alexa are very common these days. Home video monitoring systems are also much more available and can sometimes allow caregivers to get out of the house for a period of time more safely. Of course, the fall and medical alert systems, a lot of the smartwatches these days will have fall alert systems that will contact emergency services or caregivers. Make sure you always have your phone on you and always wear shoes with a back, no flip-flops or slip-ins. For outside of the home, because a lot of people are, gardeners and love being out there, and that's an important thing to still be able to do if you can. So gardening stools can be a good tool to help with being able to push up from sitting in low surfaces or kneeling. Think about raised garden beds or even potted planting can sometimes allow you to have increased access. Reachers are great options in the yard. Make sure areas of the yard are level to decrease falls, minimize clutter. Make sure outdoor furniture is sturdy with arms. And then there's different thoughts for pool access, sometimes as simple as a railing, ramp access, or there are pool lifts available. For home entrances, railings are very important for accessing any areas with steps. Putting non-slip, high contrast strips on the steps helps with the difficulty with depth perception. And then ramps, you really want them to follow the ADA standard of 1 foot of length per every inch of height of the step, because otherwise the ramps tend to be too steep and can be a fall risk or an injury risk of someone pushing someone in a wheelchair. So when it comes to living room access, so we often as therapists get asked about lift chairs. They're a little bit not our favorite, but I do recognize that they can allow people to be more independent in some ways. I just recommend considering how you're using it. Very often I say, if you need it, then use only as much as you need. So if you only need a little boost to stand up, just do that, because otherwise what happens is you'll never be able to get out of any chair again other than that chair. And then also considerations for people who have blood pressure or weakness, that sometimes suddenly being in standing can actually make you more of a fall risk. So just using them cautiously. There are railings and stiffeners that can be added to couches and chairs. Voice control remotes and environmental controls are also helpful. And then cord organizers can be really helpful to decrease clutter. Make sure you have chairs available that are sturdy with armrests. And then make sure you have space in the living room, especially between like couches and coffee tables, to allow for use of a device. Avoid throw rugs and minimize clutter. Some options for bedrooms and closets. Adjustable or hospital beds are great options to improve mobility. Once again, clearing cords and clutter, keeping your walkway clear. If you've noticed, this is a common theme. Placing an armchair somewhere that you dress, either next to your bed or in your closet. This can help just to improve your ability to, I need to sit down to get dressed. Using closet organizers can help minimize clutter, and then they do have pull-down shelving for closets. So we talked a lot about equipment for the bathroom, but some people ask me sometimes about if they're going to be doing renovations, what some thoughts might be. And so we talk about aging in place renovations, and some of those things might be installing a roll-under sink, zero threshold or roll-in shower, grab bars in the shower. I do not recommend suction cup grab bars. If you have them, I recommend you throw them in the garbage because I've just had lots of people who've had falls and they tend to be worse because you fall harder with them. So if you are using grab bars, make sure they're installed in the studs in the wall. You can also use them next to the toilet, and then making sure you have space around the toilet so that you can use a device or get a chair next to it. For the kitchen, once again, sometimes sitting down can just make you be able to do a little bit more than you used to be able to, or things that are limited. So using a stool or bringing things to the table, keep commonly used items within reach. Spanning is basically where you're standing between two surfaces, and instead of walking and carrying them, you're gonna stand there and transfer them from one to the other, or slide them along the counter to decrease falls, because we know a lot of times falls can occur, especially with PSP, if you're trying to carry things. Some equipment recommendations, sometimes a rolling cart. Dyson helps avoid slipping. There are lots of adapted cutting boards, adapted and electric jar and can openers, as well as choppers and rocker knives. There are pouring devices, and pull-down shelving is also a really great option for the kitchen. And then looking at roll-under options and spaciousness in the kitchen if you're considering renovations. For the utility room, using reachers and drying racks. They have long-handled items for dustpans, scrub brushes, using lightweight and robotic vacuums. Sit down to fold laundry at a table. That can help with coordination or balance. Use front-loading raised washer and dryer units. Use a stool to sit and access those units. And then use organizers for avoiding clutter. There's also equipment for pet care, so looking at long-handled and automatic feeders. Sometimes just elevating the food bowls can decrease fall risks. Using long-handled poop scoopers or reachers, and then automatic litter boxes. So, looking specifically at the different disease processes, when we look at PSP, we very often think about balance. So some of the main things that we can be helpful specific to PSP, make sure you're using the proper device and make sure you're using it consistently. And this is where working with therapy can be helpful because it's not intuitive on how to know how to use a walker in the kitchen. But that's something that OT can show you, and PT can make sure that you're using it properly. So also working with PT for fall prevention and recovery, sometimes practicing how to get up from the ground, whether it's with you or you and your caregiver, doing that with your therapist can be helpful. Make sure you're always pushing up from surfaces. Even if you have a sturdy walker, you want to be pushing up from what you're sitting on and encourage leaning forward. You've all probably heard nose over toes. My big one is make sure you can see your feet as you're standing up, because if your feet go out of view, you're leaning too far back. Another option can be reaching to the ground as you're standing up. You can use a laser or metronome to help with freezing, and this is an option available on the U-Step walkers sometimes. Avoid clutter and busy floor designs or tight spaces to minimize freezing episodes. And then using your rolling cart, or make sure you use your walker to carry items instead of trying to carry them without a device to decrease falls. The other big concern with PSP is vision. So the first thing is make sure you're using an up-to-date eyeglasses or contacts prescription. Well, you're probably not using contacts because of the dry eye. That's another thing I don't have listed on here, but getting good management of your dry eye is really important for optimizing your vision with PSP. PSP, you do not do very well using progressive or bifocal lenses. So using single distance lenses tends to be more effective for you. So distance glasses when you're walking and up and moving, and then using readers or up close glasses that have been prescribed for looking up close. Exaggerate your head movements to compensate for the limited eye motion, so making sure you're turning your head and looking up and down. This is very often training that you do with therapy when you're working on mobility and self-care. For reading accommodations, you can use a line guide or a bookmark to kind of guide your eyes as you're reading. Use larger print books and audiobooks. When you're eating, there are meal lifters to bring things up more into your vision, and then consider the plate that you're serving, that you're eating off of, that you want the plate color to contrast the color of the food so it's easier to see. Add high contrast tape to corners, doorways, and steps. Once again, this brings more attention when you're not able to look as much, and it also helps with depth perception. Keep regularly used items in the same place, then you have less need of visually searching for them. If you have double vision or severe blurry vision, I recommend seeing a neuro-ophthalmologist. The North American Neuro-Ophthalmology Society website can be a good resource for where to find one. And then work with OT or low vision specialist for training for visual scanning. Locally in Florida, we have the Division of Blind Services, but most states have a comparable resource in the area to connect with them for additional resources. For CBD-specific concerns, I recommend training with an occupational therapist for one-handed techniques. Wear elastic waist clothing and use Velcro fasteners for easier access. Make sure you have proper lighting when you're getting dressed and using clothes that are labeled obviously in some way that they're front and back and inside and out. Use pump soaps, creams, and paste to allow for more one-handed tasks. Keep a consistent routine and placement of items. Caregivers, it's really important to use very simple functional instructions, just because the more complex it is, then the more confused it can get in regard to movement planning. So keep it simple and give time for them to process the request. Using simple signs and guides for steps of a task, and then using lists, calendar, and alarms. We're almost done. So MSA, first the Parkinsonian type, we look at the conservative orthostatic hypotension management. So hydration's the number one, making sure you're compliant with your medication, especially if you're on a blood pressure stimulant. Use of compression socks and stockings can be helpful. The abdominal binder actually can be the most helpful with blood pressure, but actually to the fact that sometimes you have to watch for it going too high. So just be cautious. It can be very convenient, though, that you can put it on when you're getting up and walking around, and then you can kind of loosen it when you sit down. So that can be a good option. We talk about doing cardiac preload exercises, and this is literally raising your toes and lifting your heels, pumping your feet 20 times before you stand up. This just gets your heart moving and ready to go for more activity. And then once you stand up, you're gonna pause for a minute, make sure that you're feeling stable and okay, and then move. Avoid breath holding for bowel movements, and then have sitting options throughout the home or in your assistive device so that you can sit safely. For the MSA cerebellar type, we look at strength training and weight bearing to help with coordination tasks, especially proximal or core strengthening is really important. Use electric razor or power toothbrush. Sit for meal preparation or tool or coordination use. Sometimes propping your elbows can give you a little more stability when you're doing fine motor tasks. Use a staggered stance, so one foot in front of the other when you're doing more dynamic activities, like even opening the refrigerator door, and utilize your proper assistive device with training from a neurologic PT. So finally, like I said, seeing a regular OT, PT, and speech therapist is very vital for optimizing your function throughout the disease process. Medicare is approving maintenance therapy. Not all clinics or home health agencies provide it, but it is something that is covered, so that is something I recommend asking when you start with some providers. Being proactive allows for longer independence. Stay on top of balance and mobility issues. Please go to the ER or contact your doctor if you hit your head in a fall, because sometimes it's too late by the time you have symptoms. Make sure that you have proper sleep, nutrition, hydration, and medication compliance to improve your safety and independence. Exercise helps maintain function, endurance, and strength. Proper rest is helpful to optimize your function, and then participation in purposeful and meaningful activity is really vital. So I know you all probably have tons of questions after that. Feel free to email me. I'm glad to respond to you. And then I'll also be in the Q&A in the virtual summit later. Thank you all very much.